the desire to prove that psychotherapy is effective, prove it in a scientific way, is very understandable. I mean, wouldn't it be nice if we had it? But if we don't have it, but we think we have to have it, then we can end up with what I think we have now, is we'll do something else that is amenable to being disguised as though it's scientific. And that is exactly what the psychiatric profession, with the cooperation of pharmaceutical industry and government and certain community groups, have actually created the belief that we have done that. So let me talk about why I don't think we can ever do it, and then why I don't think we should even try to do it. Because what we can have is a responsible standards for becoming a psychotherapist, but the test of whether or not it's effective will be up to each individual consumer. Just like other businesses, other activities, we don't expect shoes to pass a test of that they're scientifically better, because we know there are many, many standards of who would say what is better. What are better purpose, to look better or to last longer, etc.? No, the customers. And that will get us to one of the fundamental issues that this blog is all about, that my career has been confronting, that I hope you will spend time thinking about, is, can we ever have a humane and helpful psychiatry, a helpful and humane mental health system, as long as coercion, as long as involuntary treatment is part of it? And I say no, we can't. Part and parcel of getting out of these problems that we have, we will deal with many problems, but deal the best we can, is as long as we have coercion in psychiatry, we will have these problems. Okay, I think that psychotherapy is an art, not a science. How can something become a science if you can't even agree on what the problem is, if you can't even reliably agree on what it is you're trying to help somebody with? Now, psychiatry teaches, as a profession, is teaching that, well, we do that by making a diagnosis. But that is wrong. If I want to get in my combative mode, I would say it's a lie, because I don't believe it's a deliberate deception, but I believe it's not, it's fundamentally wrong. That's what I mean by it. So it's a misunderstanding. In order to understand why psychiatrists do not diagnose anybody, and therefore cannot show ever that psychotherapy is effective any more than anybody can show that it's ineffective, is that mental disorders are not medical diseases. People can wish that they would be, and we have many patients who want them to be explained that way. Doctors who are psychiatrists can wish that they would be, and it's understandable. But the fact is that there are no mental disorders that have been demonstrated to be scientifically determinable medical conditions, things that can be demonstrated the way we demonstrate other medical disorders that are treated by internists and pediatricians and surgeons and so forth. Theories of how the brain might work have been made into mental diseases. The brain is way, way more complicated than we understand it. And when we have defined a particular condition by science, then we can say, well, look at that. But that day has not arrived, and it does us nothing but harm to claim that we have found it. Because there is no verifiable disorders of the body, including the brain, which are linked to the mental disorders that psychiatry treats, such as psychotic breakdowns, manic depression of the excessive highs and lows, depression, anxiety, behavioral conditions, sexual problems, addictions, and so forth. None of them have been shown to be as a result of faulty biochemistry and physiology. So that what psychiatrists do is take the symptoms and simply list the symptoms and call it a disorder. So if your problem is that you can't sleep and you're having too much sex, the psychiatrist says, you have not enough sleep and too much sex disorder. That's what the diagnosis is. And if you think I'm just being flippant, that is exactly what they do. And then they say, well, we have a drug for not enough sleep and too much sex. And this drug will change you for a while. We have chemicals that will change your behavior and change your brain. And if you do what Benjamin Rush did, you will define the disorder as you had a disorder in which the chemical that I gave you, the change that it made in your brain, you had the opposite problem. So if the chemical that I gave you lowered a particular neurotransmitter, those chemicals which allow the impulse to go from one cell to the next, if this drug has been shown to lower the amount of that chemical, then you had too much of the chemical. And if the drug has been shown, the different drug has been shown to make that drug go up instead of down, then you didn't have enough. That was your disorder. You didn't have enough of it, and I made you have more of it. Well, it's just like getting drunk. You can drink alcohol and you will change. And you might like the way you change for a while. But that doesn't mean you had a disease. It means you took something which changed your body for a while. So we haven't demonstrated any reproducibly diagnosable things. And that's why we cannot make psychotherapy prove it, because you don't have a condition which is so straightforward. You have something in who you are as a human being. Now, it's very important that you understand this doesn't mean the problems are not real. It doesn't mean that craziness is not real. It doesn't mean that depression is not real. It doesn't mean that impulsive, hyperactive behavior, it doesn't mean that inability to get over your depression is not real. These are real things which involve pain, suffering, and these people with these problems deserve all the help that we can give them. But it does mean that we need to rethink how we're doing it. And in coming talks, we're going to go into more detail of how psychiatry took the easy way, the self-serving way, but not just psychiatry. We're not going to put all the blame on psychiatry because they were only partners. And who is the most guilty partner of all? It's you. You watching me. And it's me. And it's Falcon and JD and Andy, the guy sitting here making this all, documenting what I'm telling you. In other words, society. We're all in society together. And we all have to take some responsibility for the fact that psychiatrists do a lot of things because we, as a society, are pinning them to the floor with our boot on their throat and saying, you got to do this, and we'll pay you if you do it, and we'll give you a lot of prestige, and we'll make you great. Just do this because we want you to do it. And we need to understand what are the forces that are doing that if we want to come up with solutions which quit encouraging psychiatrists to do what they do, create a mental health system which doesn't expect psychiatrists and other mental health professionals to be scientists in the same way. But they need to be responsible, trained professionals of the standards that our people deserve. But that begins by understanding what we're doing wrong now.